Hi, it's Katie. So let's talk a little bit about planning for January 1st. So we all know there's a lot of things that go into the calendar year changing and how a lot of things come up with insurance companies and with patients' responsibilities and with benefits possibly changing. So I wanted to kind of give you a little bit of insight into what we do in our clinics to help make things a little bit easier. So, number one, a lot of insurance companies, most of their deductibles restart January 1st. So, if you're collecting towards a deductible, if a patient is paying towards that, that has to be top of mind when you are having them come in January 1st and after. So, obviously, making sure that you're re verifying all of your patients' benefits. It sounds horrible and tedious, but is absolutely necessary to make sure that you are doing that, because if you miss something and the patient walks out that door after one visit, after 20 visits, and you haven't collected anything towards it, it's going to be a huge bill, and the patient is not going to be the most happy with you and possibly might not even pay it. So I want to make sure you're catching this before things like that happen. So out of pocket maximums, all of that stuff resets at the beginning of the year. Their copays and their co-insurances may also change. So their entire policy may completely change for what their responsibility is. So even if they have a flat copay that's $20 a visit, that may change the following year. It could become a percentage of what you're billing, or it could become a higher copay. Most cases, you don't see anything that goes lower and the patient has less responsibility, but that's definitely something to keep an eye out for. So making sure you're rerunning all of your benefits, making sure you're also communicating the responsibility of the financial portion of that with your patients. They want to be talked about with this, very transparently. They want to know how much they are going to be responsible for. So I think one thing that could get a little bit tricky is if it is a co-insurance or if it is towards a deductible, being able to have a really good way to summarize or give them an estimate about how much that is going to be per visit or maybe for their entire plan of care is really important. So being super transparent about that is going to be super key. Making sure you're collecting at the time of service. So don't have the patient come in and then you're billing them after the plan of care is over and they're discharged. Collecting those copays, those deductibles, co-insurances at the time of service is going to be super helpful. Making sure anything that needs to be updated is scanned into the chart. So if they have a new insurance card, making sure that that is put in there, making sure that all of the policy numbers, group IDs, effective dates, everything like that is put in there correctly. If you're seeing Medicare patients and they have a secondary insurance, making sure that that is updated accordingly as well. I also want to make sure that you are prepared for possibly a higher volume of claim rejections in January. Oftentimes this happens because the eligibility was not correctly updated. The coverage was outdated. They did change policies or plans or entire insurance companies overall, and you didn't catch it. You didn't notice that. So you're going to have that delay in care. It doesn't mean you're not going to get paid at some point, but if you're sending it to the wrong insurance company, you got to backtrack, and it's going to take a lot more time to get paid for that visit now. Also, prior authorizations. Rules change in January. Things change with the insurance companies based off of what their silly requirements are for getting prior authorization. Also, we tend to see delayed payments as the insurers kind of reset their system for the new year, which is crazy, but it happens. So being able to make sure that you are prepared for that. I think a few tips to be able to minimize those issues are to making sure that you're double checking eligibility and the authorization before that patient comes in the door. So if possible, I know it's hard because January 1st, most of our clinics are closed. So you're trying to kind of to run and make sure that everything is checked ahead of time. But January 2nd, making sure that every patient in your schedule is looked at for all of that information. When they walk in the door, you're updating everything. Another tip is making sure you're promptly following up on any rejections or requests for additional information. So as soon as you see a rejection, if that does happen, you're taking it head on and you're making any adjustments or appeals or finding out their new information if necessary. So I hope that helps. It's a crazy, crazy time of year when we come back from the holidays being over and everyone's full and tired and ready to go for the next year. But I think that's going to be your best bet to making sure that the new year really starts out flowing pretty seamlessly.